Hello guys, this is Lily and welcome to my YouTube channel. The focus of my video for today is all about the normative values of range of motion, which we call the ROM. First, I'm gonna discuss about the normal range of motion values of the neck. Okay, so we have the active range of motion in degrees, and we have the passive range of motion, and we're finding the end fill. Okay, so there are kinds of movements that we can do for the neck joint. Okay, so one is the flexion. So for flexion, the active range of motion value in degrees will be from 80 degrees to 90 degrees. Okay, so for passive range of motion, we are looking for the end fill, which is the tissue stretch. Okay, so for the extension, we're looking at the active range of motion degrees for 70 degrees. That's the normal range of motion value of the neck in extension. Okay, so for passive range of motion, the end fill will be tissue stretch. Okay, for the lateral flexion of the neck, the active range of motion degrees, value in degrees, will be from 20 degrees to 45 degrees. And the passive range of motion and fill will be tissue stretch as well. Okay, so the last movement of the neck should be rotation. So the rotation of the neck, the value of the active range of motion in degrees should be from 70 degrees to 90 degrees. Okay, and the passive range of motion and fill should be tissue stretch. Okay, so guys, these are the normative or the normal range of motion values of the neck joint. Okay, in relation to the various movements as we have discussed. Okay, so moving on. So the next will be the shoulder range of motion values. So we're going to be talking about the normal range of motion values for the shoulder joint. Okay, so the movements are the following. So we have the flexion of the shoulder joint, and the active range of motion in degrees should be from 160 degrees to 180. So this is the normal value of the flexion range of motion of the shoulder. And for passive range of motion, we're looking at the end fill, which is the tissue stretch. Okay, so for the extension of the shoulder, the active range of motion value in degrees, the normal value should be 50 degrees to 60 degrees. Okay, for the passive range of motion, looking at the end fill, it is tissue stretch. Okay, so for the internal rotation of the shoulder joint, the active range of motion in degrees normal value should be 60 degrees to 100 degrees, and the passive range of motion end fill should be tissue stretch as well. Okay, so the next movement should be external rotation, and the active range of motion normal value in degrees should be 80 degrees to 100 degrees, and the passive range of motion, which is the end fill, the tissue stretch. Okay, for the abduction of the shoulder joint, the active range of motion normal value in degrees should be 170 degrees to 180 degrees, and the passive range of motion end fill should be either tissue stretch or bone to bone. So bone to bone because when you do abduction of the shoulder, which is the movement towards the side of your body going up towards the ceiling, then the joint is, the two joints, the shoulder joints are, being compressed, or not compressed, they hit each other. So that's why we regard it as the end feel bone to bone. Okay, tissue stretch if the tissue surrounding it is being stretched and not there's a, the tissue is restricting the abduction of the shoulder joint. But if it goes up with easily towards the ceiling or towards the head, then it can be bone to bone end feel. Okay, there's no restriction. Now for the adduction of the shoulder joint, the active range of motion values, normal values in degrees should be 50 degrees to 75 degrees, and the passive range of motion value or the end feel should be tissue approximation. Okay, tissue approximation if the end feel is up to an extent, up to a range, up to the movement that is approximated by a tissue. Okay, so the tissue stops the movement from going forward or going from moving more range of motion. Okay, so that's tissue approximation. That's the end feel. End feel meaning the end of the range or the end of the movement of each motion of the joint. Okay, so the final movement or the end movement of the joint, okay, being moved. So that's end feel. All right, so we're gonna move on to the next, which is the thoracic range of motion values. Thoracic means pertaining to the thorax, so it's on the from the mid back to the upper back, so the thorax. Okay, and it has some movements as well, and the first movement we're going to be discussing should be the flexion movement, and the flexion range of motion and the active range of motion value in degrees should be 20 degrees to 45 degrees, and the passive range of motion and feel, the end of the range is the tissue stretch. Okay, and for the extension movement, the active range of motion in degrees, the value is 25 degrees to 45 degrees, and the passive range of motion and feel should be tissue stretch. Okay, for thoracic range of motion in lateral flexion, the active range of motion value in degrees should be 20 degrees to 40 degrees, and the passive range of motion and feel is again tissue stretch. Now for the rotation of the thoracic joint, the active range of motion value in degrees should be 35 degrees to 50 degrees, and the passive range of motion and feel is again tissue stretch. Okay, so here you go, guys. These are the normative values of the range of motion of the thoracic joint. Okay, so we're gonna move on to the next, so which is the elbow joint. Okay, the normative values of the range of motion of the elbow joint. Now for flexion movement, the active range of motion value in degrees should be 140 degrees to 150 degrees, and the passive range of motion and feel is either tissue stretch or tissue approximation. So it depends on what you're gonna find on the end feel when you do this movement to a client. Okay, so tissue stretch, when the tissue surrounding the joint during the movement is being stretched, then that's tissue stretch, and tissue approximation when the movement is approximated by a tissue that stops the movement at a certain range. Okay, so the next is the extension movement, which is for the active range of motion, a value in degrees is from 0 degrees to 10 degrees. Okay, so the passive range of motion and feel of the extension of the elbow is bone to bone. The reason why it's bone to bone because when you extend, when you straighten up your elbow, then both the joint, the bones at the end will be joined together, so it is touching to each other. So that's why it's bone to bone. Okay, it's being joined. Okay, and it's touching with each other, the end bone and the two bones, the two ends of the elbow, of the joint in the elbow is touching with each other. That's why it's bone to bone and feel. Okay, the end of the range is bone to bone. Now for pronation, okay, the active range of motion in degrees for this movement is from 80 degrees to 90 degrees, and the passive range of motion and feel, the end of the movement is tissue stretch. Okay, this supination movement for elbow, the active range of motion value in degrees is from 85 degrees to 90 degrees, and the passive range of motion and feel is again tissue stretch. So here you go, guys. These are the normative values of the range of motion of the elbow joint. So these values will be helpful in your, in any of your whatever you do in your school regarding range of motion. So it will help you for your during examinations or during your oral practical examination for your certification or board exam for massage therapy. Okay, so either in school, or this also will help you in your written examinations. There might be some questions that will address to this kind of normative values of range of motion. So as much as you can remember this, it will be helpful for you with your whatever it will be, what if it's this will be needed in your school or in any kind of examination. Okay, so moving forward, we're gonna discuss the next joint. So the next joint will be the wrist joint. So the movements we're going to be discussing and its normative values. So first is the flexion. The flexion of the wrist joint, the active range of motion normative values in degrees should be 80 degrees to 90 degrees, and the passive range of motion and feel is tissue stretch. Now for the extension of the wrist joint, the active range of motion in degrees is 70 degrees to 90 degrees, and the passive range of motion and feel is tissue stretch. Okay. For the ulnar deviation movement or range of motion of the wrist joint, the active range of motion in degrees, the value is 30 degrees to 45 degrees, and the passive range of motion and feel should be bone to bone. Okay, it is bone to bone because if you deviate your wrist to the ulnar side, or we call it ulnar deviation, then the joint touches each other. So that's why it's called bone to bone. So the end of the joint touch each other. That's why the end feel should be bone to bone. Okay, when two bones on the joint touch with each other, the end feel or the end of the range or the movement should be bone to bone. Okay, it's just a matter of memorizing these guys, because these are pretty much the normative values or the end feel of each of these movements or range of motion. Okay, so radial deviation towards the the radial side of the movement. Okay, so radial deviation, the active range of motion values in degrees, or value in degrees, is 15 degrees. 15 degrees. Now, for passive range of motion and feel, again, it's bone to bone. So either ulnar deviation or radial deviation towards the ulnar side or towards the radial side, the end feel is bone to bone. So these two, pretty much, if you can memorize, remember, then pretty much that's the end feel. Okay, so guys, these are the normative values of the range of motion of the wrist joint, and this will be helpful again on your studies for the massage therapy program in school or for taking any examinations, either your board examinations for massage therapy or your examinations in school. Okay, so moving forward, we're gonna discuss the next joint, which is the fingers or the finger joints. Okay, so there are a lot of movements here, range of motion of finger joints, so we're gonna be discussing all of it. Okay, first is the flexion or flexion of the MCP joint of the fingers. Okay, metacarpal phalangeal joint. Okay, so the active range of motion in degrees is 85 to 90 degrees. So pretty much there are no end feel recorded here. So we're just going to be discussing all about active range of motion in degrees. Okay, so PIP. The PIP finger joint active range of motion in degrees should be 100 degrees to 115 degrees. Okay, PIP means proximal interphalangeal joint. Proximal interphalangeal joint, PIP, from 100 degrees to 115 degrees active range of motion, normative values. Now for the DIP, which is distal interphalangeal joint, the active range of motion value in degrees should be 80 degrees to 90 degrees. Now for the extension of the metacarpal joint, MCP, which is the metacarpophalangeal joint, the active range of motion in degrees should be 30 degrees to 45 degrees. Now the PIP, again, which is the proximal interphalangeal joint, the active range of motion in degrees is 0, and the DIP, the distal interphalangeal joint, the active range of motion in degrees is 20 degrees, and the adduction of the fingers, the active range of motion in degrees is 0, and the abduction or abduction of the fingers or finger joints, the active range of motion in degrees is 20 degrees to 30 degrees. So here you go, guys. These are the normative values of the finger joints range of motion. Okay, for the thumb joints, we're going to be discussing the normative values. First, the flexion of the carpometacarpal. Okay, sorry. CMC, the carpometacarpal joint. On flexion, the active range of motion in degrees is 45 degrees to 50 degrees. There's no passive range of motion and feel for the joints of the thumb, so we're not gonna be discussing about that. So the next is metacarpal joint, MCP, the metacarpophalangeal joint. The active range of motion in degrees is 50 degrees to 55 degrees. Next is the IP, interphalangeal joint, which is 85 degrees to 90 degrees in active range of motion, normative values in degrees. Then the extension of the metacarpophalangeal joint is 0 degrees active range of motion normative value. Now for the extension of the interphalangeal joint of the thumb, the active range of motion in degrees is 0 to 50 degrees. Now for the abduction or abduction of the thumb joint, the active range of motion in degrees is 60 degrees to 70 degrees. And the adduction or adduction of the thumb joint, the active range of motion in degrees is 30 degrees. Here you go, guys. These are the normative values of the active range of motion in degrees for the thumb joint, for the joints of the thumb. Okay. Next is the lumbar joints. So the normative value of the lumbar joints, there are 4 movements or range of motions. The flexion of the lumbar joint, the active range of motion in degrees is 40 degrees to 60 degrees. And the passive range of motion and feel of the lumbar joint on flexion is tissue stretch. Now for the extension, the active range of motion in degrees is from 20 degrees to 35 degrees, and the passive range of motion and feel is again tissue stretch. Now for the lateral flexion of the lumbar joint, the active range of motion in degrees is 25 degrees to 45 degrees, and the passive range of motion and feel is again tissue stretch. So here you go, guys, for the lumbar joints, normative values of the range of motion. These are the values. Okay, so we're just gonna be moving on to the next joints. Sorry, there's another range of motion, which is the rotation range of motion of the lumbar joint. The active range of motion in degrees is 3 degrees to 18 degrees, and the passive range of motion and feel is again tissue stretch. Okay, so these are the normative values of the lumbar joints. Next is the hip joint. Okay, so for the flexion of the hip joint, the active range of motion in degrees is from 110 degrees to 135 degrees. And the passive range of motion and feel is tissue approximation, TA, and TS is tissue stretch. Okay. Okay, for the hip joint, the flexion again is 110 degrees to 135 degrees. The passive range of motion and feel is tissue approximation and tissue stretch or tissue stretch. Okay, so whatever is the and feel. Now the extension of the hip joint, the active range of motion in degrees is 10 degrees to 15 degrees, and the passive range of motion and feel is tissue stretch. Now for the abduction or abduction, the active range of motion in degrees is 30 degrees to 50 degrees, and the passive range of motion and feel is again tissue stretch. Now for the adduction or adduction, the active range of motion in degrees, is 30 degrees, and the passive range of motion and feel is either tissue approximation or tissue stretch. So either one is the end feel. Okay, so for the external rotation of the hip joint, the active range of motion degrees is 30 degrees to 40 degrees, and the passive range of motion and feel is tissue stretch. Now for the external rotation of the hip joint, the active range of motion in degrees is 40 degrees to 60 degrees, and the passive range of motion and feel is tissue stretch. Here you go, guys. These are the normative values of the range of motion of the hip joints. Okay, so moving on to the knee joints, the flexion range of motion, the active range of motion values in degrees for flexion of the knee joint is 0 degrees to 135 degrees, and the passive range of motion and feel would be tissue approximation. And for the extension of the knee joint, the active range of motion in degrees is 0 degrees to 15 degrees, and the passive range of motion and feel is tissue stretch. Now for the knee external rotation, the active range of motion in degrees should be 20 degrees to 30 degrees, and the passive range of motion and feel is again tissue stretch. Okay, here you go, guys, for the knee joints range of motion normative values. These are the normative values of the knee joints. Okay, so Just take note of this. Okay, sorry, there's another normative value of the knee joint, which is the external rotation movement. The active range of motion in degrees for external rotation of the knee joint is from 30 degrees to 40 degrees, and the passive range of motion and feel is tissue stretch. Okay, so here you go, guys. These are the complete normative values of the range of motion of the knee joints. Okay, from flexion, extension, external rotation to external rotation movements. Let's move on to the last normative values of the range of motion, which is the ankle joints range of motion values. Now, the following are the movements, the range of motion movements of the ankle joints. First is the plantar flexion, the active range of motion degrees. The active range of motion in degrees, normative value is 50 degrees, and the passive range of motion and feel is tissue stretch. Now for dorsiflexion of the ankle joint, the active range of motion in degrees, normative value is 20 degrees to 30 degrees, and the passive range of motion and feel is tissue stretch. Now for the eversion of the ankle joint, the active range of motion in degrees is 20 degrees, and the passive range of motion and feel is tissue stretch. Now for the inversion of the ankle joint, the active range of motion in degrees value is 30 degrees, and the end feel, passive range of motion and feel is tissue stretch. Now for the ankle joint supination movement, the active range of motion degrees is 45 degrees to 60 degrees, and the passive range of motion and feel is tissue stretch. Now the last is the pronation of the ankle joint. Now the active range of motion degrees is from 50 degrees to 30 degrees, and the passive range of motion and feel is tissue stretch. Now guys, for the ankle joints, you notice that the passive range of motion and feel is similar or all the same, tissue stretch throughout all the range of motion movements. Okay, so just take note of that. It's easier to memorize. Okay, so here you go, guys. I have given you pretty much as I can all the normative values in degrees and feel of all the joints, all the joints of the body, from the neck down to the ankle joints. These normative values will be able to help you in your study of massage therapy program in school and for any examinations that you are going to take in school or for your board exams. Okay, so I hope I will be able to help you guys with this information, and I would like to thank you for watching. Please keep watching my videos, and please subscribe, like, comment, and share my videos. And thank you so much, and have a great day.